Hello, my name is Lauren Iwanchewski, student number T00716494. This is my CM Kelly, and this is our patient Dexter, and today we are going to be doing an eye exam on Dexter. So today he was in for a dental procedure this morning. It's now near the end of the day, so he's had some time to recover from the sedation. Dexter doesn't have any eye issues. He's not on any medications. On his last exam, it was noted that he did have lenticular sclerosis in both eyes. Around the eyes, I don't see any hair loss, any discharge. On left eye looks clear, a little bit of cloudiness, but other than that, no redness or loss of hair. Right eye, same thing, a little bit of cloudiness, but no hair loss, no redness, no discharge, no swelling. So his eyes look pretty good. So palpable response, present on the right eye, present on the left. Menace response, just cover this eye. And you can see he's blinking. Other eye, you can see he's blinking there. Pupillary light response, we'll just kill the lights here for a second and open the door. All right, so if we just look at his eyes, I'll shine this light into an eye. You can see his pupil constricts there. So direct response on the left eye, direct response on the right eye, indirect response, and indirect response for both eyes. All right, and then we'll go to our ophthalmic exam of the retina. Okay, we'll start with not too bright of a light here. I'll just get down to Dexter's level here. And you want to hold it up to whatever eye is opposite from their eye. So if I'm looking at his left eye, I want to hold this machine up to my right eye. When I'm looking at his retina, I'll start about 4 centimeters away. Okay, so I can see the color, the red reflection, the retina, the vessels look clear. I don't see any blurriness. And the optic disc looks like it has a pretty regular, slightly triangular shape. Does not look like it is getting blurred around the edges there. So that's for the right eye. For the left eye, looks the same, pretty good. Good reflection. And the optic disc looks very consistent with the other eye. Slightly triangular shape, no blurred edges. So that looks good. All right, so now we'll do our Schirmer tear test. I'm just gonna pop on some gloves just to keep this strip as sterile as possible. When I pop it in. Bend this tip here so it'll sit just under the eyelid. So we'll do that on his left eye here. I'm just gonna lift up his bottom eyelid, tuck that in, and just hold his eye closed. And we'll do that for 1 minute. and I'll fast forward this on camera. Good job. Good job, you're almost done. Okay. So our result is 12. So 15 to 25 millimeters is a normal result. 10 to 15 is borderline for dry eyes. So we might be borderline there, but we're still within normal range. Now we will do our fluorescein test. So we'll take our fluorescein strip, a little bit of sterile saline. We're just gonna hold up his head and let a drip of the stain fall onto the eye. Ooh. Fall onto the eye. There we go. Okay, buddy. Turn off the lights again. And with this ultraviolet light, we're just going to take a look at Dexter's eye. Doesn't look like there's any abnormal pickup. So his eye looks pretty clear, so that's good news. Okay. Just give that one more rinse here. Better, hey? Much better. Okay. And now we're going to, while we're waiting to see if there's any nasolacrimal ducts show up, we're going to do our tonometry test last. So let me just get our tonometer ready. On, we'll just load it. Perfect. Okay, Dexter, we're just gonna hold this up to his eye here. So it says 10. 10. And 11. So that's good. And the other eye, just make it a little bit. 9. 9. And 11. All right, so right eye, pressure average of 10, and left eye, pressure average of 10. So within normal results for the, well, no wait, eye pressure, tonometry, normal. Oh no, I don't say that, just kidding. Okay, and now I don't see any of the dye coming out of the nasolacrimal duct, but a lot of the time that can take longer than 5 minutes. So I can't say for sure yet if his nasolacrimal duct is patent, but if we were to give it a few more minutes, then we would probably see some fluorescein dye coming out of his nose. So because there's less time in this video, I can't say, but if we had more time, most likely we'd see some results there. And now I'll just show you how we would put in drops or ointment into the eyes. So we'll just lift his head so that it's going back into the eye, and we would just apply a drop. And same with the left eye, just lift his head There we go. And just hold it like that. And that is our eye test.